Welcome back to the Infection Control Exchange. I'm Wayne Tucker, your host for this podcast, and this week marks a very special time in the infection prevention and control community. It is National Infection Control Week, which is running from Monday, October 20th to Friday, October 24th. And this year's theme is Bridging Gaps, Building Bridges, which highlights exactly what the infection prevention and community is about. It's about connecting people and the practices that we do for infection control. And the idea is to keep our residents and patients and the team safe. So whether you're working in long-term care, acute care, public health, primary care, or community health, this is a week is a chance to celebrate all the incredible work that the infection control staff are doing, as well as the frontline staff's support that is needed every day to do infection control. Infection Control Week isn't like just a date on the calendar. It's a time to reflect, pause, and think about everything that we're doing to keep our patients, residents, and staff and visitors safe. So, every year infection prevention control becomes stronger because of the collaboration, right? Everybody working together. I mentioned that in episode 1 regarding the vaccines, right? So it's a collaborative team effort with the nurses, the PSWs, the physicians, nurse practitioners, environmental services staff, dietary staff, and the leadership team. So it's a collaboration of everybody working together that makes infection control work. So this week is an opportunity to just draw some attention to all the hard work that everybody's putting in to keep everyone safe. So our residents safe, our patients, as well as our staff and the visitors as well. So one of the things is that, sometimes we just don't provide enough recognition for the hard work. Sometimes infection control is a little bit more in the background, unless there's something happening like an outbreak or something like that. So unlike some other programs within the hospital or long-term care, sometimes infection control except for like when an outbreak or something, it's more in the background, right? It's less visible. So this is a week to provide an opportunity to just draw some attention to all the hard work that everybody's putting in to keep everybody safe. So building bridges is always strengthen infection control, right? So it's collaboration, all the various teams that make up acute care, for example, or long-term care. We can't work in silos. We have to work together in order to keep everybody safe and in order to run an excellent infection control, prevention and control program. And this is what makes it a great program. So this week is just an opportunity to draw some attention to all of that hard work that goes into keeping everybody safe. So, and it's a chance, like in the years where I've been part of it in long-term care. It's an opportunity to engage the staff and have some fun, as well as providing education as well, right? So you want to kind of keep it kind of light and practical, but it's got a very serious message. But you want to just make it kind of fun for the staff, and there's a number of ways that you can do that to kind of make it interesting and interactive during the staff, while at the same time having that important message that you want everybody to be aware of. So it's good to keep it kind of interactive, and you don't need to make it overly complicated, and it doesn't have to be expensive for, an acute care facility or, for example, a long-term care home to do. So there's many things you can do, simple things you can do that I've done in the past as well, like daily activities. You can run trivia contests, or kind of like any challenges that encourage the staff to participate, like, for example, HandHygiene, PPE, so donning and doffing, or environmental cleaning awareness as well. So there's a number of things you can do, and if you Google or look up some activities for infection control and things you can do, like you can come up with your own plan of what you would like to do that week, and what activities. So I kind of suggest, come up one kind of activity per day. And you also got to think about that you want that activity run, not just for the one shift, so not just for the day shift or for the evening shift, but you kind of something that they can do across all of the shifts, because you want to really interact with everyone. And I know the infection control staff, the managers or the leads can't be there for the entire 3 shifts, for example. So, but you can put the things in place, and then the staff can and the charge nurse can help with implementing that during each of these days. So, for example, like on a Monday, you could have an hygiene awareness. One of the things that I've done in the past is actually go around and have put everybody in for a contest to draw for a prize. So you can just kind of what I've done. One is keep it really simple, and anybody that participated in the HandHygiene activity would get entered into a draw. So really easy. Keep it fun, and then I would, might get 50 or 70 people. Then I would just randomly pick from those that participated, and they would be awarded a prize. So Tuesday you could do something like for PPE with the donning and doffing as well. One of the things I've done in the past is just kind of just have staff practice on the floor. You're trying to keep it away from being as formal as regular auditing. It is really just a chance to kind of, in a fun, interactive way, make it fun for staff and everyone. So you can just ask them, you can do it in one-on-one, you can do it in groups as well. Larger groups does become a little harder to kind of provide feedback, because you can't be watching, 7 or 8 people donning and doffing. So sometimes it's easier to just do 1 or 2 people and just have them do the donning and doffing. And if they participate, then they can be entered into a prize for a contest, like a gift card or something like that. On Wednesday, you could just do something that's focused on outbreak readiness and some of the things that you need to have prepared for that. So, make sure that you got your surveillance measures are in place there or ready to go, that you have the supplies there as well, that you got regular supply of masks and stuff like that. So you can come up with things that for outbreak response as well. You could just ask staff some questions about outbreak management and the things that to be looking for, and just kind of ask them a few questions. You could have that created in a survey, an online survey, and then they can just participate in answering a number of questions. I've done that in the past, and then whoever does the best with the quiz, wins the prize. And then Thursday, you could do some auditing during that day, and then get some assistance from the charge nurses to help you as well. So there, it's not something most places, hospitals and long-term care might have a formal software that they enter all the audits in. So this is kind of keep it more fun, and you can do some audits just to provide feedback, make it less formal than a regular day where you're doing your regular audits. And then you can provide, the importance is to improve the practice, and you can just have staff do some auditing for you as well. So that include, as well as the HandHygiene and the donning and doffing as well. You could also get staff involved with a little bit more, and have them kind of help one another out and just look for things as each of the staff are donning and doffing, and have the IPAC manager, the lead, be more in the background, and just have them, because the IPAC manager is not going to be there all the time, or the lead on all the shifts there every day. So it really does need to build up that culture for infection prevention and control. So you want to make the staff kind of looking out for one another and helping one another out, and then they learn along the way of seeing what one another is doing, and they can provide feedback. For example, they might see something where someone's not tying the back of their gown and stuff like that, and then the staff person can mention, oh, you need to tie the back of your gown, or it's open a little bit too much, or it's open in the back and stuff like that, or they didn't tie the neck part as well. On Friday, you can do some team recognition as awards. So you can think about things that, some of the staff that are doing, going above and beyond. You see that anywhere where certain staff just put in, maybe a little bit more effort than some of the other staff. And I think this is a infection control week, is a week where you want to draw attention to some of the staff that's going above and beyond to keep everyone safe as well. So, one of the things that, for acknowledged for infection control week is that infection prevention control, like it's not a single person job. There often there might be a lead or a manager, but it really is a shared responsibility. And I kind of make an analogy with health and safety, that it's, everybody has a job from an health and safety perspective to do what they can. If you see something laying on the floor, you're picking it up, or if you see a spill, you're helping clean it up or getting someone to clean it up. So it's kind of like infection prevention and control kind of works like the same way, right? Everybody needs to be taking part of it and being aware of it. So same as health and safety, you always got to be, be vigilant of what's happening. And I see that during my time working in infection control, where staff will say, just want to make you aware of, someone on the unit, if there's a couple people sick, and just want to make sure that you're aware of it. So, it's that kind of collaboration and getting that involvement from the staff on the floor that's so important. But this week is a chance to, come together, have some fun, bring recognition to the week for infection prevention and control, and do what we can to kind of, make it a fun week, as well as a week where we're learning as well. So it's, trying to, it's just a chance for, the leadership, for the IPAC manager, for example, to be more visible on the floor during that week, where they're helping with these activities. You got to be very approachable, which you need to be in order to be effective as a infection prevention and control manager, is that you got to be approachable. If staff are not willing to come and see you, then you're not going to be aware of what's happening on a particular floor or unit, whether it's in a hospital, for example, or long-term care as well. And you got to provide, the gratitude to the staff as well. And I will draw from example for myself. When an outbreak was declared over, I always sent out a message, for example, that the outbreak has been declared over, and then I would put in my message thanking the staff for everything that they've done during the week to keep everybody safe. And then, I would also put in some things that we need to improve upon. But for the most part, keep the message pretty positive. But, we are still trying to learn. So if you did see some things that staff need to improve upon, then you need to bring that up. You can do that, through send out an email, for example, just to start. But you should be also doing that through huddles as well, and when you interact with staff, when you're walking around the units, the floors, and everything. So, this is a chance, to just like the theme it says, bridging gaps and building bridges. It really is kind of in line with that there's a lot of gaps that we need to close in any organization, and we need to build those bridges as well, and collaborate more effectively together, and work together and for the best interests of the residents and the patients as well. So I hope you take this week as a chance to just kind of draw attention to that. Like I said earlier, it is a week that for infection prevention control, sometimes it really is kind of more in the background, unless you're in an outbreak and then there's more people involved and everything like that. But for the most part, day to day, infection control kind of stays in the background, and sometimes people are just not aware of all the hard work that goes into keeping a facility or a long-term home, for example, safe. So as we celebrate National Infection Control Week, I hope you'll take a moment to reflect on the impact you make every day. Infection control staff are doing an awesome job, and I think this is just a week to bring some attention to all of that hard work. So think about the theme for this week: bridging gaps and building bridges. And think about it as not just a theme. It's the foundation of how infection prevention and control works, and in order to be successful, it is a team effort and collaboration of everybody within these facilities, working together. So thank you for joining me for episode 2 of the Infection Control Exchange. The focus this week was on National Infection Control Week, which starts today, October 20th, and runs until Friday, October 24th. So, take the time to, have some fun with the week, be creative. And if you do need some ideas, there's plenty of ideas that you can Google and look up for the week and things you can do. One year, like I said, another thing I did was actually create a word puzzle, and that's very easy to do. You just go on Google, you can look up, create a puzzle, how many words you want in the puzzle, how big of it you want to be, and stuff like that, and it just creates the word puzzle for you. And obviously it's Infection Control Week, so you focus all the words that are related to infection control. Put up some posters, have fun with it, get the staff involved, and then that just gets them a little bit more interactive into the week, and have fun with it as well. And it's good to sometimes take some pictures as well that you can to capture the moment of what you were doing the week and everything. So, but thank you for joining me. Like I said, if you haven't yet had a chance to look at episode 1, episode 1 was just me introducing myself, and again talking about the vaccines like COVID-19 and influenza vaccines, so which are now available, including this episode will be as well. But I've posted the first episode on Spotify, Apple Podcasts, and YouTube. So until next time, stay safe, stay engaged, and keep building those bridges, and hope everybody has an awesome National Infection Control Week. Thank you. Bye.